Hi, good morning and welcome to the ZP Developer Zone. So we like to do this Developer Zone once a week, and it's really just answering technical questions that have come in during the week. So I'll jump straight into it. Today is the 21st of July 2024. So question number one, I and the questioner here are aware of a gentleman called Wei Gao, or Associate Professor Wei Gao at UCLA, University College, Los Angeles. And he does a lot of wearable technologies, and he's just done some papers recently on, or in at least recent years, on C-reactive protein. And the questioner here would just like me to sort of make some opinions on that, and which I will do, and that will be question one today. So it'll be talking about wearables, C-reactive proteins, and in particular a paper from Wei Gao. Somebody else was, in the end I thought it was a question, but I think the question was just, actually I think they've been successful in immobilizing luciferin. I gave them some advice previously, and I've also got a lot of materials on the web about enzymatic sensors, and congratulations, I think they've actually been successful. They were asking me if I could be a co-author on the paper, which is very appreciated. Before I agree to be a co-author on the paper, I would like to see a draft of the paper, obviously, because I want it to be of a certain quality. So send me a draft, please. But anyway, I'll talk about question number two as well. If you are question number two, please watch the demo that I'm going to show in a bit as well. I'd be very interested in you seeing the demo. At the moment, this person's using a gold disc electrode, so I'm very keen for you to watch the demonstration that I'll do shortly. When I say I'm going to do a demo shortly, actually, this is a very, very new type of potentiostat. It's a cloud-enabled potentiostat, and actually this is going to be relevant to somebody else who's asking about DNA detection as well, and other people who are asking about immunosensors and aptamer sensors and RNA and DNA type sensors. So please hold on and watch the demonstration shortly on this. With that said, let me go back to these slides. So we will talk about that, just very briefly about that luciferin sensor. Question number three, somebody's having a problem with DNA. They are using screw-printed electrodes. I mean, obviously at Zimmer and Peacock, we're one of many manufacturers of screw-printed electrodes. I am going to talk about the problem in the world of screw-printed electrodes. What we'll see actually in that question is that there's at least three vendors out there, because if I include ZP as well, and there are more than that, of course. The reason I'm sort of saying that is because actually that number of vendors is actually causing a problem. And then number four is how to make an immunosensor, and if you're interested in making immunosensors, if it's DNA binding, if it's aptamer binding, even if it's enzyme based actually. But I'll be talking about immunosensors in question number four. This demo that I'll do during this webinar today will be super useful to you. With that said, let me go back to here. We do have some upcoming webinars, so if you're interested in doing point of care diagnostics or point of need diagnostics, point of care, point of need diagnostics would mean that you are using a technology like this, where you were kind of putting a sample onto a sensor, let's say, and you've got a rapid detection of an analyte. So actually question number three, who actually wants to do some clinical trials, this will be super interesting to you. What will be super interesting to you is actually you've got the hardware, the sensors, and we have this very app driven. I know they were very interested in having a screen on the device. In fact, I mean, the lowest cost way of getting a screen these days is actually an Android phone, and maybe I'll talk about that as well. So we have a webinar on the 7th of August. If you're interested in doing clinical diagnostics, etc., please come to that on the 7th of August. We always do 2 sessions on the day. We are mindful this is a global community, so we have to do one in the morning to obviously cover India, Pakistan, Indonesia, Australia, etc. And then we do one in the afternoon, because then it's easier for our colleagues in Canada, USA, Mexico, Brazil, down into the Americas rather. So we do 2 sessions and it's the same for the wearables webinar as well. Questioner number 1 is very interested in wearables. I appreciate that they've been looking at this for years, so they might find it interesting to come to the wearables webinar on the 31st of July. Again, 2 sessions, one in the morning, one in the afternoon. If you're in academia and you're very interested in translating your science out of the lab and actually into clinical settings, or just into really creating impact, there's a very important metric. I think governments are right on this, that they're starting to say, look, is your science impactful? And that means, getting your science out of the lab. So we do have a couple of sessions on that, one in the morning and one in the afternoon. Question number 1 is about CRP, C-reactive proteins. I have to say that I'm only using these images because basically just I don't know, reviewing and commenting upon the paper. These images were created by Professor Wei Gao at UCLA. And in that, then, the images kind of give me a clue as to what they're actually up to. So they're trying to measure C-reactive protein. C-reactive protein is a good inflammatory marker. I think normally when you're when you don't have inflammation, it's quite low, and then it does come, it increases as you sort of have. I mean, I've seen it as a marker for heart attacks. I think I've seen it or cardio infarctions. I've seen it as a marker for sepsis. So C-reactive protein is an inflammatory marker. They do show, their electronics. You've got to notice slightly that the electronics are sort of slightly conceptual. And you'll also notice that they're using an immunoassay, and that will become important in a bit. Now, I think they were using differential pulse voltammetry. So there's 2 voltammetry methods that are quite sensitive if you're doing these kind of binding assays. Differential pulse voltammetry and square wave voltammetry. Honestly, I don't think there's actually much difference between them. I have a slight preference towards square wave voltammetry, and it's probably worth saying that as I wave my arm around this, you'll see that this can do square wave voltammetry, and that will be something that I will discuss shortly. So we can see it's an immunoassay. We can see that they get the signal out by differential pulse voltammetry. But I just want to then, again, these images and this data is Wei Gao's, and I'm only using it really to comment. What's interesting then is if we look at if we look here, we can see that in fact they have an inlet. The inlet kind of goes through a reservoir, and it's picking up reagents. I presume it's these gold nanoparticles that are kind of that are decorated with some sort of antibodies here. So they're basically picking up material. The sample comes in, they're picking up reagents, and then they kind of come into the sensing chamber here. It's probably worth noting that they've got, and I'll make some comment. In fact, I'll make some comments on that now. That they've got a finite reservoir. This means that this sensor will only, let's say, work for a finite period of time. Something that just occurred to me as I was speaking actually is that also, I mean, this reagent reservoir will probably be at 37 degrees Celsius, or it'll be somewhere between room temperature and body temperature for some time. So you could appreciate that actually, I don't think necessarily these reagents are going to be necessarily that stable. I can see some antibodies in there. So antibodies, people tend to freeze them, keep them quite, cold. But it does have a finite reservoir, which means it can't last forever. Because it's essentially they're adding reagents to the sample as it comes in. It's probably worth saying that there are at least 3 sensors in here. What I mean by that is there's an impedance sensor, so they're kind of mindful that they may be sensitive to the conductivity of sweat. So they do have an impedance sensor in here. That's here. They do have a CRP sensor, the C-reactive protein sensor. So I would call that the working electrode. So they do have a sensor for the CRP. And they also have a pH sensor in here as well. So they have at least 3 sensors. So the only reason I bring that up is because when you look at most glucose sensors, there's really only one sensor in there. that's the glucose sensor, but they're actually trying to do 3 things at once, which you can applaud them for, but you can also understand that that is complexity. So I was just, initial looking at this. They got a finite reservoir. They got 3 sensors. The analyte concentration. So when I look at the analyte concentration, if I just take, they've obviously tested this in 1 nanogram per milliliter to 20 nanograms per milliliter. I did a calculation on what 5 nanograms per milliliter actually looks like, and I'll do that on the next slide. So it's certainly not a criticism of this paper. It's just to say that it'll be quite a challenge to commercialize this technology. Now, UCLA are in California, and California is pretty close to San Diego. Sorry, it's in California. They're in, I think, a place called Torrance. So above them on the map, you've got Silicon Valley, and below them on the map, you've got San Diego. So you do have plenty of people in those areas who have both financed sensors and also have the technical capability to commercialize sensors. So I'm not saying, it's impossible. I'm just saying this is quite a challenging, let's say, product to make. And I just want to talk about that analyte concentration. So this is BioLink. I don't own this image. I'm only using it to illustrate that this is BioLink. This is what their sort of product looked like at least 4 years ago. The product's still in development. In the last 4 years, I think they've raised about $158 million US. Now these guys are only doing glucose. So they've raised $158 million US so far. They're only doing glucose. I don't own this image. It's only to illustrate that this is the Dexcom. Dexcom have been around, I would think now, for at least 20 years. Just out of interest, I think to get to market, Dexcom for doing glucose spent about $500 million US, which I think is really interesting actually, because they just had a quarter, and I just heard it, that in that quarter they made a revenue of $1 billion US. So it does show you that doing wearables, if you can get the investment, is a really a long game, if I can put it that way, because obviously you think, wow, Dexcom raised $500 million US to get to market, but of course 20 years later they just had a quarter where they made $1 billion US. There's not a profit but a revenue of. But so it shows you that actually, if you get it right, you can really do well in wearables. And some of those some of these large numbers, let's say, become quite small. So I suppose the thing about C-reactive protein is it's very hard to actually get the business case. You can argue the business case, but nobody's done a CRP wearable sensor yet. With CGM, with continuous glucose monitoring, actually the business case is already, so let's say, proven. I just did some calculations, seeing that. We see in Wei Gao's paper that one of the concentrations he was interested in was 5 nanograms per mil. I could convert that into grams per mil. I could convert that into grams per liter. I could convert that into moles per liter. And therefore I can see that 5 nanograms per mil is 0.22 nanomolar. Now glucose is 5 millimolar. So the ratio between 0.22 nanomolar to 5 millimolar, that ratio is about 23 million. Now the reason I bring that up is that you're trying to measure a molecule, admittedly a macromolecule. It has what's called a molecular weight of about 23 kilodaltons. So you're trying to measure this macromolecule, but it's actually it's 23 million times less concentrated than glucose. So it makes the problem much tougher. The reason I bring that up as well is because people will ask me, well, is it reasonable to do this? Yeah, it can be done. Eventually, I think it can be done. And Wei Gao is in California. He'll be very, let's say, he will know people who have done things like the CGMs, and he'll know investors. So I'm sure he'll understand this, but understand how, because of the concentration, how tough this is. So if you really want to, let's say, make a C-reactive protein, I would easily argue that this was just as tough as glucose. And in fact, from a molecular concentration perspective, it may be 23 million times harder than glucose. it's not true because it's not linear like that, but it is actually very low concentration. And you would probably be, in the end, spending something like $500 million US in order to do this. Now at ZP, we actually have a lot of experience in this, so actually I think we could be much more efficient, but it's not going to be a super low cost way. You can't bootstrap yourself to doing this C-reactive protein. You would have to do it quite professionally and get funding quite professionally. So in summary, the paper has a limited reagent. That reagent's at body temperature, so I can see that having a bit of a lifetime problem, if I can put it that way. I think it's got at least 3 sensors on board, and as I say, also this concentration thing about glucose is actually not easy, but it's easier to do as a wearable because in fact it's at quite high concentration relative to C-reactive protein, and that ratio between clinical glucose and clinical CRP might be 23 million to 1, so it's quite tough. So that would be my comments on that paper. I'm very pleased with this. Like I said, I don't have a lot to say here because I thought originally it was a question, but it was really more of a kind of question whether I would be on the paper, which does sound interesting, but I would need to see a draft of the paper. But it was nice that somebody was actually able to get enough material out of our website and our YouTube channel, and we have an academy to actually immobilize the enzyme, so that's nice. They're using a gold disc electrode, so I'd hope that in a later paper they would think about what I'm about to say now, which is about translating their work off a gold disc electrode. I think they're quite interested in commercializing it. So in fact, if you're interested in commercializing it, come to the academic webinar, which I think, I don't want to get this one wrong, was on the 7th of August this year. So at the moment they'll have a setup like this. I'm much more keen that people actually use screen printed electrodes. Why? Because actually when you look at the image on the left hand side, that's what I would call technology readiness level number 3. So NASA invented a scale, technology readiness level number 1 to 9. This scale has been around for years and years, but now I think it's getting much more commonly adopted. They have a scale, TRL levels, technology readiness levels. So when you look at the left hand side, this would be like a lab proof of principle, which would mean, okay, when I look at that, that's TRL 3. Now, I'm obviously slightly biased, but if it was able to translate onto this potentiostat using electrodes like this, with an app like this, I would describe this as much higher technology readiness level. I would start describing it as a technology readiness level number 6 or 7. In fact, most of the aspects here are technology readiness level number 9, but the sensor that the electrodes they're using at the moment, they're doing it on a gold disc, and therefore that was at a technology readiness level number 3, but this potentiostat platform is actually at a much higher technology readiness level. Let me go back to my screen anyway. So the left hand image is a TRL 3. Using screen printed electrodes does raise your technology readiness level because in fact you're now on a manufactured substrate. But be very, very careful about screen printed electrodes. This is going to appear in question number 3. So hold on for question number 3. The potentiostat, I don't know what they're using. It may be bulky. It may have cabling. So at ZP, we're trying to replace the traditional looking potentiostats with something that's much more, something that can be commercialized and translated into the clinical setting much more easy. In fact, I can just show you that in just one way. So here's a sensor. How am I going to make it fit to that potentiostat? Well, I pick it up, put it in there. It's click, done. No cables, no slots, no bulky potentiostat. It's really kind of a smooth, let's say, operation. It's not driven by PCs. Somebody was asking earlier on about a screen, because I can understand that if they want to take something out, in this case, it's question number 3, wants to take a technology out into Pakistan. It's going to be really tricky if you have to take PCs, etc. out there. What you're going to find out is that when I do my little demonstration shortly, is the whole thing is driven off an Android phone. And Android phones, I would suggest, it's also, by the way, driven off an iPhone as well. But I think for low cost, you can get an app for this on the Google Play Store or on the Apple App Store. I only mention Android because actually I think it's a lower cost platform if you're trying to roll this out, but it gives you the screen. This is in Bluetooth connection, and with this device, I can see it says here device connected, and that means that they're in Bluetooth connection with one another. So just back to my, so we would like to make sure that people are using a potentiostat. That's also the technology that can be used for productization as well. I would definitely say come to the academic webinar to see a bit more about that. I've got more slides about it. Rather than be PC Windows driven, it's app driven off the smart device. So this is definitely something that we now have commercially available. And I think what you'll need to do, if there's a cloud management system that Zimmer and Peacock invented, we built it, we maintain it, called Julie. This cloud management system is a unique cloud database. It actually can receive electrochemical data. So if you open an account on Julie, later on you can actually install an app on your smartphone called Sense It All. So suddenly you have a cloud system and you have a app system. Now the app, you'll find out, is a conduit to Julie, that we can actually bring data into Julie using the app, and I'll do a demo with that later in a bit. If you open up a Julie account, you'll end up creating it using your email, and you'll end up creating a password. Later on, you can then install an app on your smart device. If you've got an Android, you can use this QR code. When you log into that app using your Julie credentials, then your app is in sync with Julie. Then here's the app one. So if you're on, the iPhone device or the iOS device. So if you've got an iOS device or an iPhone, you can scan this QR code and that will install the app on your app device. I'll just do a quick demonstration actually for you. So I've got all these QR codes up here. So what I'm going to do is I'm just going to scan amperometry. So what I'll do now is I'm just going to, so for each method that we would want to use this potentiostat. So when I say for this potentiostat, this is a potentiostat. It's also the same instrument that can be used to start commercializing your hardware, your technology. This is the potentiostat. It doesn't know what to do. It's the app that tells it what to do. At the moment, the app is saying amperometry. This app is also saying connected, so it's actually connected to that potentiostat. Just wondering why that's so blurry. It's connected to that potentiostat, and I'm sorry about the blurriness on that particular camera, by Bluetooth, and it's telling it to do amperometry. Now what I'm going to do is I'm going to scan the next QR code. So I'm going to scan the next QR code. And it says open circuit potentiometer. I'm just going to change the camera for a second. So now it says open circuit potentiometry. What I'll now do is I'm going to scan the next QR code. Now it says impedance spectroscopy. Now I'll scan the next QR code. Now it says linear sweep voltammetry. Now I'll scan the next QR code. Now it says cyclic voltammetry. And now I'll scan the next QR code, and it says square wave voltammetry. This is square wave voltammetry. I know Wei Gao in his paper used differential pulse voltammetry. Square wave and differential pulse, I think, end up bringing you to a very let's say similar place. I must admit I'm not quite sure why that is quite so blurry, so I apologise for that, but it is a little bit blurry. Hopefully there's enough. How do I put this? There's enough focus that I can at least do what I want to do. All right. So that said, I'm just commenting that when you do research on disc electrodes, it really holds back your technology readiness level. So there's potentiostats now. Zimmer Peacock's one of them. That exists that are app driven. This one's actually a little bit different. It's actually cloud enabled as well. So I did tell you that. There's something called Julie. If you register for it using your email name and you register, or email address rather, and creating a password. If you use those credentials then in what's called the Sense It All app, which you can install Julie and the Sense It All app will then be synchronized. What's very different about this is, even though my phone now is showing square wave voltammetry, the way this system works is you can very quickly actually turn it into an analyte of interest. So there we are. I mean, I know this is chilly and this is not necessarily exciting to everyone, but just understand that each one of these QR codes, and if you do install the app and you are successful at logging in, you can actually go from all these different analytes. At ZP as well, it's probably worth saying that if you scan this QR code, you're going to find out that actually we built this so that in fact you can skin this app or rebrand this app so it's actually your app. So understand that we built a model where basically people can put their own branding on this and their own sensors on this, and essentially go to market on that. It's probably worth coming to either the academic webinar or the Sense It All webinar to see me do a bit more of a deep dive actually on that. I'm going to do a quick demonstration now. So let me just go here. I'm just going to shift this slightly, see if I can get this to focus, but I don't think unfortunately it's not going to focus very quickly. So I've got an app on my phone. The app is in Bluetooth connection with the meter. I'll put a sample on there, so I appreciate that's a little too blurry, and I do apologize for that. I can't quite figure out what's going on here, but I'll put the sample on here. Sample's gone on. If you want to see another demonstration of this, by the way, we do have those upcoming webinars as well. I'm just going to give it a quick name actually. So I've given it a name because I want to find the data later on, and now I'm going to start measurement. Understand, so at the moment there's a progress bar that's turning around. Understand that in fact what this is doing is it sent the method file to the potentiostat. The potentiostat is now running it. You can see a little, if I just put my finger here, you'll see the end of my finger just glowing. It's very nice the way I get this user feedback, and in fact it's actually running cyclovoltammetry, and it's giving me a result. So it's giving me a result of 842 micromolar, for example. Now that's quite a nice user experience. It's very unusual to have that kind of user experience. I just want to share my screen with you because this is the real good kicker on this. Screen 2. It actually sent the data to the cloud. So in the time that I was, how do I put that? In the time that I was actually chatting, the data actually got uploaded to a cloud system called Julie. It actually ran cyclovoltammetry. The only reason we didn't show the cyclovoltammetry was because we don't want to confuse the end users. If you're working with clinicians, or you're working with agronomists, or you're working with water quality or environmentalists, they don't want to see cyclovoltammetry, for example. But actually what it did was, this is cycle 1 and this is cycle 2. What it's done then is, this is a really powerful bit, that rather than just leaving it as an electrochemical signal, it's actually from the peak height calculated the concentration. And the way it was able to do that is, if you're a ZP customer and you're using the Sense It All potentiostat, then this is what you can do. Is we didn't do anything with scan 1. We just didn't. This is cyclovoltammetry. I'm going to just hide my camera. I'm just going to hide my image for a second actually, because I realize it's slightly blocking what I'm showing. So I'll just show that again. So the data came up to the cloud. So we got scan 1, we got scan 2. We actually processed it. On scan 2, we didn't do anything with scan 1, but on scan 2, we filtered the data. We didn't really need to filter the data because it wasn't very noisy. We extracted values from it, and we fitted those values to a formula, which was basically what you do in the lab. It's a calibration that you would have otherwise done in the lab. So you have an equation, and it actually calculated from that. So you can see it visually what it's done here. We flipped the data around, so we rotated it around the, or you could say reflected it around the y-axis. We then found this peak. We told it where to look. It found the peak height. It measured the peak height, and then it, using the formula, converted it into concentration. Can you understand what that's done is it's not technology readiness level number 3. Most scientific papers would report this, they would report this, and then they may put a calibration curve in there. That's why scientific papers finish with technology readiness level number 3. This actually just turned that raw data actually into a meaningful concentration. And this is the kicker. If I can just share my screen with you for a second. Sent the data back to the phone. So that's the experience that, let's say, the clinician gets. They can see the sort of result. They can, if it was C-reactive protein, they can see how much C-reactive protein is there. That is the bit where actually you go from technology readiness level number 3 to higher technology readiness levels. As I say, this is a very unique type of potentiostat. I mean, I know I've never seen anything quite like it, and this is something that we've been working towards at Zimmer and Peacock for the last. It probably started 10 years ago when we actually still started the business. There was always this vision, with anything that's any good, it takes a long time to kind of get there. So that was my sense of the cloud demonstration. Number 3 is about DNA assays, but actually what I've just demonstrated, I suggest, is super relevant to them as well. We need to test our DNA biosensor assay in the community. Okay, that's good, because to be honest with you, if you want to test it in the community, you need the Sense It All platform. In the community, you can't be putting laptops out there. You can't be putting Windows-based systems out there. This is in Bluetooth connection with the hardware, and the results go straight to the cloud. That's really important, actually, because when you're doing work in the community, you've got to know where your data is. And the fact that every time an assay is run and the data goes straight to the cloud, that's really important, because then you can put an ID in for the patient, not the patient's name, not their address, not their birth date, or anything like that. Put an ID in for the patient, run this assay, get a result goes to the cloud. So it's saved, which is really good for your quality control later on. Let me just look at this. So they want to do DNA for the community. They need 4,000 to 5,000 screen printed electrodes. They've bought a small number from 2 other companies. They've never bought from Zimmer Peacock, but they found out one of them doesn't work properly. This is a really poignant point, and I want to work on this. I want to talk about this, to be honest with you, because this is happening a lot. What's also holding people back at technology level number 3 is actually the screen printed electrodes. See the comment here, they get a reasonable price, but they actually didn't work properly. Reasonable price and didn't work properly. That's a quality issue. Reasonable price, but didn't work properly. It's almost like the price wasn't reasonable. The price was completely unreasonable because it didn't work properly. They have some technical problems here. So I think here they say here that the sensors are only stable for about 4 days. I would suggest that, shelf life, most molecular assays are actually stored in at least fridges, if not freezers. So when you make DNA, now DNA I think is actually quite robust, but people do tend to store these things in fridges or freezers. I could understand the community setting in Pakistan could make that actually quite tough. So I do understand the challenges of that, but realistically, most of the sensors that ZP develops, there are commercial electrochemical DNA sensors out there as well. I could think of GenMark DX in Carlsbad, California. They would be storing these in the fridge. But it is reasonable to expect stability after 4 to 5 months of storing in the fridge. If you're not getting stability, you've either got a problem. It's either a problem of your functionalization, or you've got a problem of your functionalization and its attachment to the gold surface. But 4 to 5 months in the fridge is a fine expectation. You should be able to match that. It's really interesting here. The samples from my biosensors can be biological. Do you have a reusable microfluidic system? Right. In the end, I mean, imagine this, so my saliva is full of my bacteria, my viruses, it's a really contaminated sample. It would actually be considered a biological risk, my saliva. Now, that means that if my saliva goes onto something, the best thing you can do is actually then dispose of it, because then you dispose of the risk. If you try to reuse things that have been in contact with the human body, then you're risking the clinician, because the clinician is now going to be exposed. You're risking the next patient because the patient's exposed. Your microfluidics have to be low cost and they have to be disposable. Otherwise, you're going to have to do such a risk assessment that, let's think about HIV or something like that there's not going to be any kind of contamination of that device, and that the next person using it is not going to also get, let's say that become contaminated or infected, I should say, with that bacteria or that virus. I generally don't think you can be having biological fluids like saliva on a device and then reusing it for the next patient. I can understand you could write a discussion about, oh, I cleaned it. It's really never going to fly with a real regulatory approval that actually you ever cleaned it, because the next thing you have to prove then is that you cleaned it, and that's a really tough challenge. So I can't say it's a good idea to reuse things that are otherwise going to be contaminated with people's saliva. Do you have a potential stat with a screen? I would argue that we do have a potential stat with a screen. This potential stat works in Bluetooth connection with this phone. So the phone is actually providing this screen for this particular potential stat. So we did have a couple of potential stats. Then they weren't terribly successful. So in fact, we've ended up replacing them now with this guy, which is the Sensi All potential stat. But I can understand that those are two different devices. That's not a bad thing, by the way, because you've essentially got a cost here and a cost here. But the phones are quite low cost, and the phones also a lot of computational power, and they provide internet connection as well, so we can send all the data to the cloud. The main problem, one of the problems this person faces, is that they have a reasonable price, but actually some of the sensors from one of the vendors don't work, and I got a suspicion that the other vendor doesn't work either, because after 4 days the recurrent response is reduced a lot. So there's a real problem going on here. The main problem with people using screen printed electrodes is this: they're looking for a low price. Now the reason they're looking for a low price is because the market will provide them with a low price, and also they're thinking about glucose strips. Most type 1 and type 2 diabetics today in India, Pakistan, etc. are testing their blood with glucose strips. I might just grab a glucose, actually I'm not going to grab a glucose strip. Glucose strips are low cost. The reason that they're low cost and they're high quality, so therefore people expect that screen printed electrodes will be low cost. Okay. But in fact what's happening is they're getting low cost or reasonable, but actually they're also low quality. That low quality then is preventing people from actually being able to A, use the sensors in the lab, and B, even harder to use them outside of the lab. The problem that's going on here is there's more choice than demand. In this just email correspondence, they've identified 2 vendors. It wasn't ZP. So if you add ZP, there's at least 3 vendors. There's a lot more than that. There's more choice than demand. There's an oversupply in both standard products and also in customization, but there's basically an oversupply. Let me discuss what that means. I think that whoops-a-daisy. I realized I wasn't sharing my screen at all when I was making those points there. So let me just share my screen for a second. I think the main problem this person has is they want a low price, they get a low price. Actually, what the vendors don't tell you, there's actually a problem with low quality, and most academics then find out about this quality issue. There's more choice than demand. There's plenty of vendors out there. In this little discussion, I could identify at least 3 of them, 2 of them by this person, ZP being the 3rd one. There's oversupply in this market. Now, what I mean by oversupply in this market, there's at least 10 people out there who will make you a screen printed electrode. ZP is one of them. We are part of that problem. People come and go in this market. There's quite a churn in this market. Not only, and each one of these vendors will probably be offering you something like 50 different products: gold, platinum, carbon, different geometries, 2 working electrodes, multiple working electrodes, different sizes. There's lots and lots of choice. And then you've also got fellow academics who are also making screen printed electrodes. I would suggest that the vendors are making a slightly, it's not because they're doing it in a kind of in a controlled environment. Sometimes the screw-fed electrodes from the vendors are slightly better than the necessarily the home produced ones. But let's say there are at least 10 sources of screen-printed electrodes there in our world. And in fact, each of these vendors is producing something like 50 screen-printed electrodes. That means there's at least 500 products on the market. There's much more than that. There's much more vendors than this. They're carrying a lot more products than this. There's much more than 500 sensors of screen-printed electrode products on the market. The problem is, if you imagine your own work, how many screen-printed electrode or even electrochemical experiments are you doing per annum? Because I would strongly argue that the total market for screen-printed electrodes was actually sorry, I'm just trying to get rid of that image, is actually only 1 million experiments done per annum. Think about how many you're doing. Think how many labs in the world do what you do. There's really not more than 1 million screen-printed electrode experiments or even electroanalytical experiments happening per annum in academia. That means that if you took those 500 products and you evenly shared those 1 million total experiments to do 500 products, these products are only being made at 2,000 per annum. Or in fact, what it means is that somebody, see this sheet of screen-printed electrodes? This sheet of screen-printed electrodes has 300 screen-printed electrodes upon it. That means that if my back-of-the-envelope calculations are correct, in order to supply the global demand for screen-printed electrodes, I'd only need to produce 7 sheets. 7 sheets is not even, it's not high volume manufacturing, it's not even low volume manufacturing. It's almost, how do I put this? It's almost no manufacturing. That's what I was trying to do. I was trying to get rid of that. So the problem we've got here is that there's lots of vendors producing, and academics producing lots of screen-printed electrodes. There's probably over 500 products out there. You've only got a very finite demand, less than 1 million, I would suggest. And if you take 1 million divided by all these products, you only end up with 2,000 screen-printed electrodes. Now, even in this questionnaire here, the person wants 4,000 or 5,000. So I appreciate, these are back-of-the-envelope calculations. But just understand that there's so much supply out there, it's diluting the total you've only got 1 million demand. 1 million demand diluted by 500 products means that, we can produce most of the global need for a particular product in 7 sheets. So the problem we've got is that SPEs are manufactured, they're left on the shelf to age. And the problem that you've actually got is it's only high volume that can drive low price and that can drive low prices and high quality. It's only high volume that can drive low prices and high quality. But none of these screen-printed electrodes that you're using and sourcing are produced in high volume. So what you end up doing is paying a low price. In fact, then the manufacturing to produce them is actually quite low volume. So that low price that you demand and the low volume that you actually need actually ends up with low quality. So at Zimmer & Peacock, we've really shifted this because we realize that people want a price, but they actually get low quality. The only way we're going to fix this is actually we know that the price has to stay the same, but the quality has to come up. How do you fix that? You fix that by saying to people, all right, at Zimmer & Peacock, we do carry a lot of screen-printed electrodes. But now, if you contact me and say I want a carbon electrode, I will say to you, please take this 501 carbon. If you want a platinum, I'll say take this 501 platinum. If you want a really low cost carbon, we do have a slightly lower version, which is this hypervalue carbon. If you want a lower cost platinum, we have this one. If you want a low cost gold, we have this one. What does this say? It says that rather than us at ZP saying, okay, we have 50 screen-printed electrodes, you can have what you want, we have to be quite strong with people and explain the reason that we are saying don't take our other products is because otherwise these are produced in low volume. We focused in on making these products high quality because we get high volume and we can offer you a good price. So at ZP, for example, we're offering this one at €1.76 each at the moment, and we're offering these ones at 90 cents each. I'll try and remember to put all the links underneath the video when I finished. I just want to say about the thing that we focus on at Zimmer and Peacock is actually reproducibility of screen printed electrode. It's reproducibility of screen printed electrode that's holding most academic research back. What's happening is actually people are getting low quality, they're getting low reproducibility. At ZP, we really focus on reproducibility. If you watch a demonstration from Zimmer and Peacock, you'll see that when we do biosensors, there's no calibration. It leads to simpler assays. Simpler assays lead to easier to commercialize, and easier to commercialize means more impact. In fact, when I think about screen printed electrodes, a lot of the time people are actually having more complex assays than they otherwise require, because they're doing things like calibration on board the cartridge. And the reason they're doing calibration is because, in fact, the screen printed electrode is not repeatable. They have to compensate for it. They have to calibrate, and that leads to a whole host of problems. So at ZP, we really focus on reproducibility. We make in high volume, and we make sure that we take a sheet. So we call this sheet 2. We'll take, a dozen electrodes off here, sacrifice them and just test them to make sure that they're repeatable. We'll do it on sheet 6, different sheet, of course, sheet 18, sheet 21. You can see that we're producing at quite high volume because this is 21 sheets, which means that we're producing about 6,000 in that particular run of screen printed electrodes. And then we look at the peak height and we look at the standard deviation. We make sure that our relative standard deviation is single digit. When you've got relative standard deviations on the screen printed electrodes at a single digit, because the relative standard deviation is 6%, you could argue, I can do the calculations for you, and I can then determine how much that's going to add as an error into your assay. But if you can get the relative standard deviation of an electrode below double digits, then you start to be able to make a diagnostically useful clinical assay that doesn't require calibration. So we make sure that all our sheets are repeatable and that our, basically reproducible, I should say, rather than repeatable. So we, on average through that run, we had a peak height when we were doing the voltammetry of 5.86 microamps, and we had a relative standard deviation of 5.8% RSD. And then when we're making assays, then we could actually see each color represents concentration. There are something like 3 screen printed electrodes being tested for each concentration. You can see that our error bars are very small. So this person is suffering basically reasonable price, but actually what nobody's telling you is about the quality and the irreproducibility. And at ZP, we've really focused on the quality, which is actually due to the reproducibility. And the only reason we manage it is because of the high volume manufacturing. And it's because we're not saying you can have every design you ever imagined, or there are thousands of designs, because those thousands of designs or hundreds of designs are leading to low volume manufacturing, and we can't give you low price and high quality unless we have high volume manufacturing. A lot of what I've shown you, I'll put links underneath this video as well. The last thing I just want to talk about is microfluidics. Now, microfluidics are something that we're pretty good at ZP, especially low cost microfluidics. I don't have anything on the website that actually is for sale, let's say, but this is just work that we've done fairly recently at ZP, where we've been able to put our screen printed electrodes into microfluidic cartridges, and then we can distribute the sample accordingly. So I just want to kind of say, if you are a commercial organization and you're looking for a biosensor along with screen printed electrodes and biosensors, don't hesitate to reach out to us. Question number 4, I'll go quite quickly now. If you're looking to make an aptamer, an immunosensor, then please have a look at this paper that I was an author of years ago. Maybe use one of our carbon screen printed electrodes. We've got a nice way of carbon, by the way, is if you've got a choice between gold and carbon, always choose carbon. Gold as a commodity is 28,000 times more expensive than carbon. People say, I want to make a low cost sensor, and then they start using golds, and gold and low cost don't go together. Carbon and low cost go together. And then the only reason that people use gold so much in biosensing is because of the self-assembled monolayers. But actually, that's probably a 30-40-year-old technology at this point. You can use pyrene NHS, for example, as a coupling agent, which is in that paper. I'll put a link to the paper. You can bind your immunoassay, your antibody to there. You can block the surface to stop non-specific binding. in the paper we do describe how you can actually follow the assay using signal voltammetry. And then in this paper we did actually use differential pulse voltammetry to actually read the binding, though these days I'd actually be using EIS or square wave voltammetry as well these days, and I'd also be, of course, super biased. These days I would definitely be doing it on these kind of electrodes using this kind of app driving the new potentiostat from Zimmer and Peacock called the Sense It All potentiostat. So question number one, I am aware of the Wei Gao's work. I respect it. I'm sure he will respect the fact that we've analysed it. We understand that it's a good piece of work. Of course, we understand how it works. We understand the complexity of it. We did a back of the envelope calculation, just show what that sort of analyte concentration is relative to glucose. I do appreciate that C-reactive protein is, I think, about a 23,000 kilodalton protein, whereas glucose weighs, God, I'm going to get this wrong, about 180 dalton. So I understand the difference in mass and that can affect, but just on a molecular level, there's 23 million more molecules of glucose to detect in the clinical range than there are of CRP, so it's quite tough. Question number two, I'm glad that you've done the work. Appreciate it. If I can have a draft of the paper, that'd be great. I would like you to do the work in future on platforms that are more commercializable. Gold disc electrodes, they will always remain in the lab. Question number three about your DNA. I hope I've shown you that at ZP we've tried to overcome your root cause problem here, which is those screen printed electrodes. And I've also given people, I'll put a link underneath this video for a particular paper that I think people should use. So if you've got any, whoops a daisy, I realized that, in fact, I didn't show any of that just a second ago. So I'll just, these are the questions, and I hope that you found the answers interesting. If you've got any questions, don't hesitate to reach out to us, and I will speak to some of you soon. And don't forget those webinars. Okay, thanks very much.